Good evening, good evening, good evening, Patmos Chapel family and friends. I'm Dr. Ezinne Akamiro, your Health Ministries Director, and I am joined by the illustrious Dr. Olele. Good evening, sir. How are you today?
Hey, thank you for having me.
Thank you. Thank you. Actually, briefly, let me just introduce the program. So welcome everyone again to It's the Stress That Are Blessed, as we were reminded of the publican who went to pray. And he was blessed by the fact that he could lay all his stressors upon Christ, whose shoulders are stronger than ours. And just a brief reminder of the program. We started on May 8th with Dr. Randolph Brooks, a board-certified psychologist, who talked to us about anxiety and stress. And he talked to us about some simple self-help things that we can do with mild anxiety. However, he said that when you do have anxiety that's starting to interfere with our daily lives and any type of form of depression, you need professional help. We are stressing the fact that we no longer suffer in silence. And so he, as well as Dr. Olele and some of our other guests, are here to help you. And then we also, again, just recommend you seek a professional to help you with any kind of mental health issue that you are undergoing. On last week, we were blessed to have the Booker family led by Dr. Alfred Booker Sr. He and his wife, Sister Louise Booker, are family health or family directors for the family ministry for multiple conferences for several decades. And they stress the importance of family, especially in this pandemic time where so many people are isolated and going through family issues and struggles. And one thing from them that they talked about that I thought was really key and poignant was the act of forgiveness. And that forgiveness is not just for the other person, but it's mainly for you, because it releases you of the stress, of the pain, of the hurt that may have been caused by some relationship issues with that other person. They also talked about the journey to what looks like a perfect family. Looking at them now, you think they had no issues in life. All their children are raised happy in the church, but they did talk about the struggles particularly, and were very transparent with the issues that they did have with their first child, with Alfred Jr., who did struggle with illicit drug usage, who was incarcerated, who left the church, and who, to be honest, at sometimes his parents, Dr. and Mrs. Booker, were unsure of whether or not their firstborn son was alive or dead. And the struggles with that in terms of being the directors of family ministry and then having their own family issues and struggles, and how some people threw salt in their wounds. But if it were not for a praying mother, Sister Booker continued to pray and reminded God of the promise that if we raise these children in the way that they should go, that when they are old, they will not depart from it. And I was there to witness on their 60th wedding anniversary. Alfred Booker Jr. gave his life back to Christ within the Seventh-day Adventist Church, and he actually publicly apologized to his parents, to his siblings, for all the pains that he had put them through. So again, forgiving yourself, forgiving others, and that it is a journey. Many times we're seeing the finished product. We see these MDs behind these names, these DOs behind these names, and we think, oh, everything was perfect, but it is a long, long journey. Now, let's start with session number 3. Again, we're blessed to have Dr. Ifeanyi Olele here with us today. Highly educated young man. Clearly from his Naija background, that's what we do. We collect degrees, and this one has collected several, starting with his Bachelor in Science in Psychobiology from the University of California, LA, also known as UCLA. And you're an LA native from what I understand. All right, LA. I'm not a Lakers fan, but because you're here, we can do that. Then you went on to get your master's in medical sciences at Hampton University, where you met the beautiful Dr. Mrs. Chichi Olele, your beautiful wife. And that's how we know each other. Childhood friend, we grew up together. People always thought that we were sisters. I say, absolutely, yes, we are. Sisters from the continents and Igbo babes, all of the above. From there, you went on and got your doctorate in medicine from the Philadelphia College of Osteopathic Medicine in Philadelphia. While you were there, you also received your MBA with a concentration of Health Services Administration from St. Joseph's University in Philadelphia. From there, you came a few hours south of me in Miami, where you did your residency in psychiatry and were also chief resident, okay? And while you were there serving as chief resident, You then came back up to the DMV, the DC, Maryland, Virginia area, and you founded and are currently the CEO of GPS Services, the Genesis Psychiatry Solutions. And so we are grateful to have you here. And you don't just have one job, you have many jobs, two of which happen to be the medical directors of some mental health clinics that are in Prince George's County, as well as in DC. You have offices for your clinic in McLean, Virginia, as well as DC. So you are all in the DMV area, but tonight you are here with us at Patmos Chapel to talk to us about what you do, the services you provide, and how we can help get our people taken care of, not only from the outside, but also on the inside. Now, sir, I see that you started very early with your interest in psychology with your psychobiology major. So talk to us about what prompted you or what inspired you to start with mental health so early in the game.
Yeah, so at UCLA, I was very involved on campus. And what kind of helped me into my transition into mental health was I was a resident assistant. So that means somebody I live in the dorms, and I was in charge of the floor of all the different students there. And from there, I had many interactions with many students from different walks of life. And as the RA, they would come and tell me their problems. And I would learn a lot about the students on the floor. And I was also a student health advocate at UCLA. So
Okay.
I was a combination of a student health advocate and RA. And so having those two different disciplines on the campus and just talking to students about their problems, being homesick, that's what led me into my interest in mental health.
Perfect. So did you always think that you would go into being an MD, or did you think about the PhD route to be a psychologist?
I always knew that I was going to be a physician. So that was like from day one. I was going to be a biology major, but I wanted more. When I found out about the psychobiology concentration, I was like, let me just dig into this so I get the blend of both. So I always knew that I was going to go the physician route.
Gotcha. Okay. Classic Najah for you. All right. Now, with that, I saw on your website. So again, people can find you on GPSMINDSET.com. They can also find you in many places. They will not find me on social media with your with your handle of GPS Mindset. You are on Facebook. You are on YouTube. You are on TikTok. You are on Instagram and Twitter. So they can find you in all those places. But one thing on your website that stood out to me was the fact that you talked about you wanted people to be whole in mind, body, and spirit. So talk to us about that, what that means, how we do that on a day-to-day basis.
Yeah, so in medical school first, I went to the Philadelphia College of Osteopathic Medicine, so I'm a DO. And from there, that's where I learned about the concept of mind, body, spirit, where I'm not treating the mind and the body, but I also have to pay attention to the spirit. And just from day one, having that mindset, I've always tried to look at my patients holistically and see what ways I could treat them. And I don't see them as a disorder, but I see them as a person trying to improve their life, and they're going through a struggle. And so being a psychiatrist and practicing with that model, I do prescribe medicines. I'm able to provide therapy, but I'm also try to be spiritually connected with my patients. And there's been some patients that have asked me, hey, doc, can you pray for me? And we pray for each other. So I'm very in tune with my patients. And if they want to bring that part into the discussion, I'm more than happy to do that.
Gotcha. Now, you mentioned prayer. Now, that is something that I do want to talk about, because a lot of particularly within I hate to say minorities, because we're not minorities in anything, those of highly melanated skin, there is a stigma of reaching out to have psychological services of any kind, particularly if you're in the church, because the answer is always, well, pray it away, fast it away. How can we get the word out that, as Dr. Brooks had talked about, you can have God and a therapist? How are you finding that you're able to get people to open up and realize that God gave us all special talents and gifts, and such as yourself as a mental health provider, that is something that we need, and we need to tap into that. And everything is not just a prayer away.
Yeah, and speaking on that, and I'm very glad you talked about that because when I talk to patients and they're saying they're praying to God about their depression or anxiety, whatever medical ailments, but I also talk about that God does answer prayers, and God's probably send you to like bring in like a psychiatrist or mental health provider or whoever into your life to help serve you. So you're kind of like ignoring him when you're getting his help. So
I love that.
so so I think that God does, I know God answers prayers. And so when patients come to me, a mental health provider like myself, I first want to know who they are as a person. So I want them to know that I care about them, I see them, I hear them, so they don't think that they're case number such and such. Like they're a person with a name, last name, life, dreams, goals. So I think with my patient experiences, they see that I'm trying to be very authentic and genuine, and I want to see them win in life and help them get through this rough patch they're going through.
Absolutely. And I think what you said is so key, because having been on both sides of medicine, having been a patient and also a provider, you can definitely tell the difference as to when somebody's treating you by your medical record number versus when somebody sees you as a person, as a human being. And that's something that a lot of people, especially those who are highly melanated, do not get a lot of. And I think that's part of the reason why we're seeing so many of the health disparities that we see, both physically and emotionally. And another thing that I did see on your website that I did want you to talk a little bit more about was about cultural psychiatry. What is that? And help us to understand why we need it.
Oh, it's important because when there's different cultures, and with psychiatry, mental health is different in different the way people view mental health, the way they experience it. So with the culture psychiatry, you're focusing on that person's culture and how that intertwines with their life. And so being in my experiences working in minority populations and training and whatnot, I especially in the South Miami area, I learned a lot about cultural psychiatry and learning about different people's customs, the way they view health, the stigmas. And when you come with a respect towards somebody, their cultural history, their beliefs, whatnot, I feel that the patient will connect with you better instead of me coming and saying, this is how it's going to go down. You're going to follow XYZ. I want to know, like, okay, is this respectful of the way we talk or the way we communicate, body language, learning about different things. And if you don't know, ask. And I've asked patients different times about their customs, or somebody, like, even if somebody's from a different religion, I also ask questions. So having a natural curiosity, that's where you're putting their life, their quality of life in mind. I think that's very important.
It is absolutely very, very important. And then speaking on that note, because you talked about, with the different cultures, particularly in South Miami, or South Florida, excuse me. But also I have a friend whose daughter, they live in a very predominantly white area and they're African-American, and whose daughter is looking at what high school to go to, and is adamant that she wants to go to a high school that is multicultural, because she wants to have that experience. And especially in today that we're starting to really talk about and not erase the complexity of discrimination in this country, how important is that not only within immigrant populations, but also within cultures that may not be the dominant culture?
Yeah, that's very important, because because if you feel like you are like minority or whatnot, you're not heard, you're gonna feel isolated, you're gonna feel alone, and that's where depression and anxiety could creep up, and even stress, because even though a lot of people don't look like you, they don't look like you or not, are they taking interest of your culture, or are they just looking over and like doing like one rule for everybody? And yes, everything's fair and whatnot, but just also there's things culturally that other people do or not do. And so taking into account and being inclusive, because everybody wants to feel included. So when you're not, when a student, like for example, once a student wants to go to school that is multicultural, that's telling me that's somebody that wants to be in an environment where they can learn about other cultures and also share their culture, feel comfortable, and they don't have to conform into what everybody's doing. But everybody's like, okay, yes, there's a majority here, but we see you, we hear you, and we want to learn about your culture, and that will help us out. And I think having a multicultural discipline is very empowering, because as a person, like as practitioners, for me as a provider, me having experiences with people that are from different countries, different religions, different anything, that helped me out and helped me for the next patient that I saw. So I definitely understand where a student want to come, because go to a school that where representation matters.
Yes, and you had some serious representation in your educational catalog. So you went to UCLA, which is a predominantly white institution, and you also went to Hampton University, which is an HBCU, and it's 757. Shout out to Tidewater. So talk to us a little bit about your experiences in that, especially when you get to the level when you're in higher education. How do people navigate that? Because sometimes, again, some people were able to pledge, and I see that you are a proud member of the Alpha Phi Alpha Fraternity Incorporated, and so you got to have a brotherhood that way. Did you also have a brotherhood at UCLA, or different organizations at UCLA that helped you feel more comfortable within that culture?
Oh, definitely. So at UCLA, so I'm talking about both experiences. So at UCLA, the Black community was very small but very tight. So that was
Okay.
like people. So there was a thing called Black Wednesdays, where all the Black students would come on Bruin Walk. There was an area in UCLA, would come congregate, fellowship with each other, and that's where you were able to meet other students from different, like sophomores, juniors, seniors, and everybody would look. Most people would look support the class below them, and so that's where I had a great experience at UCLA, even though there are not many people of color or Black, but the support was great. I enjoyed my experience. And I even took that to the next level of joining Alpha Phi Alpha and Fraternity Incorporated. So in my chapter, I created great bonds, and we were able to connect with different organizations on campus, but also the Black Greek community as well. And so we all were involved in community service and leadership. And so we were about highlighting our strengths to the community, and we were well respected. So that was very powerful. And then we also had a Nigerian Student Association at UCLA. So that was also great, where I also had an opportunity to connect with different Nigerians in our area. And so I loved my time at UCLA, but it was so huge, and a lot of times you could feel isolated and alone. And sometimes the professors didn't have my best interest or whatnot. They didn't care. I was a number. So that was where it was a struggle, a personal struggle. Sometimes you would reflect, is there something wrong with me? Or
Correct.
you start doubting yourself,
Correct.
and sometimes it can knock down your confidence, especially being a pre-med in the sciences, and you don't see many people of color there. And it was tough. I saw a lot of people, decide like the pre-med track was not for them. And it was sad because they didn't get the support from some professors. I'm not going to say all professors, but there are some professors
right.
that they were like, all right, I'm going to fail you. So you look to your left, they look to right now, and they say somebody's not going to be there by the end of the semester or quarter. But, I made it out and as a pre-med. Then I went to Hampton University, and that changed my career trajectory, because the reason why was like coming from that institution where there was few Black students. I go to a school full of everybody was Black, and I was like, wow. And the teachers cared. The teachers were inviting you to dinner, and I was like, what? I was like, you care about me?
Right.
Yeah. So not to say that there weren't some teachers that cared for me at UCLA, but it was just I felt the love of teachers at Hampton. It was smaller classes. It was more everybody, you knew everybody in your class, and it was very supportive. And here's the difference. They were like, yeah, you're going to finish. You will get it. They're like, there's no, maybe not. You better work hard. And they were on you. And so they had a high standard of excellence. So
there you go.
That's what HBCUs do, is like they have a high standard of excellence for their students. Your students are expected to graduate and be excellent after graduation. So that was a great experience. And I met my wife there too. So that
I
was
going to say if you didn't.
Yeah, that was at the end. So
it all worked out for you. And I am so glad you talked about that, because I've only experienced PWIs, and I can say, yes, there are some people that will kind of take you in, but a lot of it is you are a number. A lot of it is sink or swim on your own. Do the best you can. Well, I did take one summer course at Norfolk State University. Shout out to the green and gold. And it was completely, like you said, completely different. Like, to be in a place where people expect you, because people live up to expectations. And so when people expect you to succeed and demand it of you, I think that is such a blessing. And I think that that's something that young people need. They need to see those role models. And when you don't see a lot of teachers that look like you, or you don't see a lot of people that are, as accomplished as you. I remember one time when I was in medical school, we came down to Hampton for a convocation. And I remember one of the gentlemen, who was actually from New York, but living in Richmond at the time, he looked at the banner. And at that time, the teacher of the year for the country had been, was a Hampton University graduate. And so they had a billboard congratulating her on being teacher of the year for the nation. And he said, oh my gosh, I've never seen Black people elevated to that level. And it's like, what? And, these are the things that when you see, it is important. It lets you know what you can be. And that's why it's so important when we saw that young man touch President Obama's hair, because he's like, hold on, somebody that looks like me can do all of this and be all of that.
Yes.
So I'm so glad that you said that. So shout out to all the HBCU, shout out to Oakwood. Want to represent them as well. And one experience that I did, because now we're about to get into the nitty gritty. One experience that I had while I was in medical school, I had a close friend of mine who was struggling academically. And she had failed some tests and ended up having to repeat a year. And one of our administrators, another African-American lady, took an interest in us. And again, this is what we're talking about, being able to take people in, took an interest in us and said, you know what, I think you need to get tested for adult ADHD. She got tested, and she was diagnosed with adult ADHD. She got started on some medication. She was able to retake her test, did fine, did well after that, graduated, went on to a residency, and is now practicing board certified. Let's talk about that. Let's talk about ADHD. I saw you had one of your videos that talked about ADHD is not just for kids.
Yes.
Tricks are not just for kids. It can be seen in everybody. So tell us how you diagnose somebody with ADHD, and then when it comes to the point where you may need medications.
Yeah. So it's very interesting. I'm glad you talked about that, because I do get a lot of professionals, and we're talking minority. A lot of them.
So we got issues too.
Okay. Yeah, so professionals and minority professionals that come in and they're like saying that they've been struggling at work with their focus, attention is affecting their personal, occupational life, and even somebody that's a grad school or student, their academic life. And they know that there's something better than that, and they're struggling. So that's the story I hear most of the time. So when they come into my office, I walk through different symptoms with them to see where things are falling. Like, I ask some questions like, are they making careless mistakes and missing details? Do they have a struggle with sustained attention when reading? Do they have struggles with remembering obligations? Do they struggle with listening to people? So that's just some of the few questions I ask them, and I try to see if it's at home and at school or at work. So I know it's at different settings and not just one place. So
Okay.
that's very important.
Okay.
Because if it's at one setting, it could be anxiety or whatnot. So that's why you have to be very detailed. I as a practitioner, have to be very detailed to find out the settings and understanding what's going on with the different symptoms. And then I also look for hyperactivity and impulsivity. Like, for example, if somebody's talking, do they find themselves interrupting somebody all the time? Do they blurt out answers before the questions are asked? Do they have a hard time sitting still? Do they feel squirmish, restless? Do they always feel like on the go? And
Like I'm getting diagnosed.
yeah, so so those are some of the symptoms I'm looking for, and then I also try to see like if there was like a history of it, and then they start looking back and thinking about it, and they're like, yeah, I remember my teacher used to tell my mom that, oh yeah, he's a great student, but he just can't sit still or he can't focus.
Mhm.
He's always his mind is wandering. So when I'm getting that historical information, that helps as well, because a lot of times, especially coming from an immigrant family, and I've heard
Mhm.
a lot of times, they're like, oh, there's no such thing as ADHD. Focus, stop being lazy. And so
Exactly.
that's the storyline I hear a lot of times, where their parents are saying, oh, stop being lazy, you can focus, stop being distracted. And so that sometimes lowers somebody's confidence, and they doubt their abilities.
Yeah.
There are other those who did well in school because of the fact that they had structure, but when they leave the confines of their high school or their home, and they go off to college or grad school, that's when things start crumbling, because they didn't have that somebody pressing on them, so they don't have the organizational skills, poor planning, and with all the different amounts of symptoms. And so that's when we talk about it. Then I discuss with them about medication options, where I see that there are some medications that could help them with reduce the symptoms they're experiencing. And once I get them on it and they come back months later and we do evaluations and checkups and I ask them the symptoms, they notice, most of them notice
Okay.
improvement. They notice that they're having better quality life, and even their colleagues or even classmates or teachers recognize that there's an improvement. So ADHD is very real. And one thing is that, as a person, if you do feel like you have these symptoms, see a mental health provider like myself, and we'll be able to check to make sure that it's true ADHD and not like depression or anxiety, because depression, anxiety, and ADHD, one of the things they have in common is distractibility or concentration issues. So we got to see if they're depressed. I would look to make sure I look at depression and anxiety first before I say, oh yeah, you have ADHD, because of those things I talked about earlier.
Okay. So you want to rule out depression
Yeah,
first, and
yes,
then
anxiety.
okay.
Yeah.
Why do you want to rule out depression first?
Because people who are struggling with depression can have problems with concentration. So,
Okay.
so that's one of the things I want to make sure that they don't have. Or if somebody has anxiety, they're always thinking about things. Their mind is distracted.
Okay.
So just that alone helps me out. But if they don't have those symptoms and everything matches up with ADHD, then I'll diagnose them with that and give them the proper treatment, and also give lifestyle recommendations as well.
Okay. Now let's talk about that, because they're gonna say, okay, I'm telling you what I think people say and what I feel like I would say. Dr. Olele, please, can we try lifestyle modifications first? Because I'm scared to death of taking medicine.
Yeah. And here's the thing. I always tell them there's no pressure. So I tell them in this 30-minute or 60-minute session we have, there's no pressure for you to take the medicine now or when not. I give them information about the drug, and I tell them, think about it and take time talk with your family members, do your research, and message me, and I'll put you on. We had the discussion. However, if they don't want to get on it, I respect that, because I want to help them out. So here's some couple lifestyle hacks that I help them with, such as
Okay.
if you're having problems remembering obligations, technology is caught up where you could put like reminders on your Google Calendar, and you'll have these pop-ups where tell you, okay, time to go to class. You got this meeting. You got this meeting. So we talk about that. Their programming. If somebody is always forgetting something or misplacing objects, one of the advices I tell them is get a bowl. Let's say, for example, it's your key you lose all the time. I say get a bowl and put it in one centralized place. Make sure you always put the key there.
Every
So
time.
every time, because you know that the keys in the bowl on the kitchen counter. So we know that. So if you're looking for it, you know it's there. So that's one of the hacks that we do. Then structure is very important with anybody with ADHD. So I recommend getting a whiteboard, putting your schedule down, a task list. So that way you could maybe check mark it, cross it out, whatever works for you visually. So that way you could have some routine and structure. Then another thing I talk is color coding things. So if somebody has like a binder, get those dividers with the different like green, red, blue tabs, and just organization's key, because a lot of times some people with ADHD and some people who don't have it though too, like their backpacks or briefcases are cluttered or with papers like hanging all over the place. And so that's where sometimes like some people forget to turn in their assignments, or they can't meet deadlines. So being organized is very important. And so those are a couple things that where I give some lifestyle modifications in regards to that. And we try to be very like rigid and struck, because since we're not working with medications, we have to go a little extra harder with the structure.
Gotcha. Now, who knew all this time I was treating myself with all these things? Well, look, so you open the door to talk about depression. Now, recently, I don't know if you're aware, but recently, Snoop Dogg's daughter, Corey Brodus, was admitted to a psychiatric facility because she unfortunately attempted suicide due to her depression from many things. Some of the things that we talked about, the fact that she felt that she didn't fit in with her surroundings. Obviously, you know, her father being a celebrity and having money, she felt like she was a victim of colorism, where she felt because her skin was darker, that she wasn't seen as beautiful. She also suffers with lupus. And so we know, you and I know, that lupus can have some psychological issues outside of just the fact that you're dealing with any chronic disease, especially an autoimmune disease, just because you sometimes can feel like it's what's wrong with me, just that feeling like it's in my DNA that I'm messed up. So she was dealing with all those things. And then, you know, unfortunately, Googled, I guess you can find a lot of stuff on Google these days, Googled how to overdose. And prayerfully and gratefully, she sent a note. She sent final goodbye to her family. And it was her aunt that called her. And when her aunt called her, she didn't want to pick up the phone, but because she loved this particular aunt, she picked up the phone. And her aunt asked her, "What's going on? Where are you?" And so she finally did end up giving the room number where she was. And then the paramedics came and all of that. Now, with that, she did end up getting admitted to a psychiatric facility. And so that's usually where my part ends. I usually, in Florida, it's called a Baker Act here in Florida. So whenever you're admitted to the hospital with thoughts of suicide, especially if there's been an attempted suicide, we will hold you against your will, because we want to make sure that you're safe. Now, once medically you're stable, then I say, okay, it's okay to arrange for you to be inpatient at a psychiatric facility where, sir, you would probably then take over. Talk to us about depression, particularly that leads to suicide, and then what happens once somebody gets to a psychiatric facility, because that was something I thought was very keen that she talked about. She said that she knew to lie. She knew to say that I wasn't trying to kill myself. I was just sad. I was just trying to sleep. I wasn't. But then she then came on social media and said, no, I was trying to kill myself. So talk about once either self-help fails, maybe medications fail with depression, and then you find somebody within a psychiatric unit. What are the goals of inpatient therapy? And then how can friends, family be supportive?
Okay. Yeah. So I might be lengthy. I'm gonna give a heads up. I might be lengthy, but there's
for it. This is what we're here for.
Like a lot of good nuggets here. So first, depression. So here's some common symptoms that I look for in depressed patients. One, first, they have a depressed mood. And then some of the things I look for is sleep disturbances. They're sleeping too much or sleeping too less? So that's one of the things I look for. Then I evaluate in regards to their appetite. Are they eating too much, or they're eating too much, which is more weight gain or weight loss? So that's there, those two different spectrums I look at. I mentioned earlier about concentration. A lot of patients complain of difficulty concentrating. Some patients may complain of fatigue, low energy. A patient may say they feel guilty, worthless, hopeless, a sense of emptiness. So that's something I'm always looking for. Then are they like, they, you notice like physically if they're talking more slower, there's some things I have to look at their mannerisms, like where they're like we call psychomotor retardation, the way they're moving or talking very like is this like
Very retarded. Yeah,
yeah,
very
so
slow.
those are some things that I look for. Then the big one, the suicidal thoughts. Are they thinking about like killing themselves? Is the thought of suicide just constantly playing in their mind? There's some patients that don't want to act on it, and it drives them crazy that they're thinking about suicide because they have family members, and so a lot of them tell me that they have these thoughts, but they don't want to do anything. They don't want to act on it. They just want it to stop. And so, but there's others that their depression is so severe that they want to end their lives and end their pain. So in general, yeah, that's what I deal with a lot of patients that are struggling with depression. And I do talk to them about treatment options. There's therapy, they could see a therapist, or if I could also provide therapy with them as well in regards to their depression. Then there's medication management where I could treat them with antidepressants, a mood stabilizer, or antipsychotic, because there are people who have depression that can hear voices based off their depression. And so we do treat with that. And then there's also non-medical ways to treat them, like I mentioned, therapy. And then there's new technologies such as transcranial magnetic stimulation, which helps with treating depression. Then there's ketamine, there's an off-label ketamine infusion, and then there's one that's FDA approved with the Spravato is like a nasal S-ketamine spray, which helps with depression. And there's different modalities in treat, and also electric convulsive therapy, ECT. So that's more like they do it inpatient in the hospital. So those are the different ways to treat depression. So now the next step is we have a depressed patient who's severely depressed. It's affecting their occupation, personal life, social life. They don't want to, they're withdrawn. They don't want to interact with people. And you see somebody just falling apart in front of your eyes. And family members do tell me this person is not the same anymore. They're struggling at work. They're struggling in their families. And there comes a time where, as a psychiatrist, if the therapist and outpatient therapy and medication management is not enough, sometimes to prevent hospitalization, I recommend a patient going to a partial hospitalization program.
Okay. What's that?
Exactly. So a partial hospitalization program is a step below a hospital inpatient, and it's a step above outpatient, what I do. And I used to work in partial hospitalization programs, and it's a great program. They're usually 5 days a week, and it's kind of like you're going to work. It's usually hours are typically like 9 to 2, 9 to 3. A patient goes there, they're getting medication management, they're getting individual therapy, group therapy, and all different modalities of therapy based on the location, such as music therapy, art therapy, so talk therapy. So they're working on themselves as a whole. And this is to prevent inpatient hospitalizations. Some people are in the programs in a minimum of 2 weeks. So that's, or longer. Excuse me.
Bless you.
Thank you. So some people are there for like a minimum of 2 weeks. And then there are cases where if the patient's not improving, or they might be a danger to themselves, they may get stepped up to an inpatient hospital and inpatient hospitalization. So that's that track from partial hospitalization programs. But then on the flip side, let's say, for example, like you mentioned earlier, with somebody being, there's a couple options. A person could go voluntarily into the hospital if they meet symptoms, especially if they're suicidal. So they could go in voluntarily. They're not detained, whatnot. and they're able to work with the hospital staff. And the same thing, a person who goes involuntarily, they don't have their rights, quote unquote, is they're like on hold usually for like possibly up to 72 hours, and everything could vary based on state. So I just wanted to put that caveat there. But when they're in there, and once the hold is lifted, then they may have the opportunity to, anybody has the opportunity to sign out against medical advice, but a good portion of people do stay there because medication management, they're getting therapy, there's group therapy, there's like a lot of these different modalities are going on in the inpatient unit. And every hospital is different. So many people have different experiences. And I can understand where families and patients are scared. I totally get it because people hear horror stories, see things in media where you go there. Because I remember one time in the hospital, a guy had some passive suicidal thing, but he got, for some reason, he got admitted because he was suicidal. But when he got into the hospital and he saw the severe cases in there, he was like, I won't do this again. I won't do this again. Please give me.
That was therapy within itself. He was treated, cured, automatic.
He was like, please send me I won't do this again. Thank you. I learned my lesson, But so so I've seen it all. But there's cases where you're, as a provider, like I do see people who are hurting and they don't want to exist anymore. And when you meet them and talk to them, especially in the hospital setting, I think that's when the real work happens, because the doctors have the ability to see which medications could work. That's where the best. I like it when patients are in the hospital, because you can now be aggressively titrate, experiment what works, versus outpatient where, based on, I give you a prescription, you get bottles. And so now if it doesn't work, we have to do it all again, prescribe a new thing.
Don't know if you're taking it, not taking it.
Yeah, exactly. It's all eyes on you, 24/7. The hospital staff talks about all the patients, so they know what's going on. They're eating their meals. They're able to focus how they get along. So this is a time where you get your individual attention, and your family's involved if you allow them. If you're an adult, you could give consent for your family members to be involved.
Okay.
And there's like a social worker, therapist, a team approach in helping this patient. And then after we get to the patient to a level where they're able to be discharged, the support team that they're working with sets up appointments with their outpatient provider, so they're discharged and that they can make the appropriate follow-ups, or they've stepped down to a partial program. And when they're done with the partial program, sometimes they step down to an intensive outpatient program, which is like 3 days a week instead of 5 days. Okay. So there's a system in place that many people don't know about.
I was going to say, and who knew? I didn't even know.
Yeah, but it's like a lot of the other providers from other specialties don't know this, but this is what goes on in the mental health world. And I'm very proud to be a proud member of the mental health community, because I do see the work that they do to save lives, and I encourage, like as a provider, I make sure I cooperate with the therapists, their family members, because I'm only seeing them for an X amount of time, but they see them in the household or whatnot, and I love hearing the stories what they tell me. So I always ask, can I get a release of information so I could speak with their family members and we could collaborate? And some don't, but some do. But the more support they get, I feel there's a better chance for healing.
Say that again for the people in the back.
Yeah, the more support you get, the better chance of healing. Like, it takes a village to raise a child, and I believe in that. So you got people supporting you, praying for you, and looking out for you, helping you make your appointments, checking in on you. So if you see somebody down, they're going to be struggling in silence because they feel alone. Yes. Because when you're depressed, depression is a very isolative disorder.
Yes, it is.
You're stuck in your thoughts. Your vision's your perspective is blurred. You don't see things going well. Like believe me, depression does not discriminate. You could be poor, you could be rich. Depression does not discriminate. And so
we've seen it. Yes.
Seeing people who are like, you're like, wow, you got this, you have this lifestyle, you travel around the world, and they're depressed.
Anthony Bardot.
Yes.
I mean, all like
Yeah, they're depressed.
Kate
And
Spade, I mean, Robin Williams, and Pookie and Ray Ray down the street.
yeah.
You know, all of them. And I think that's the biggest thing I picked up on my psychiatry rotation was that the people who do the best are the people who have good support systems. And so I'm so glad that you said that. So people, don't be afraid to tell somebody. Everybody has somebody, someone that they can trust to say, hey, I am struggling. I am struggling. And if you don't feel like you have someone, even though I'm very sure you do. I know your wife in one of your videos said you won't know how many people will miss you and how many people will be so hurt if you do succeed in taking your life. But if you want to talk to somebody, we have to give them the National Suicide Hotline number, which is 1-800-273-TALK. That is 1-800-273-TALK, which is 8255. And so depression is real. I know you wrote an article about young Black men in college that are taking their lives. And so this thing is, it's very serious. And so again, I'm so glad that you're on to talk about that. A word, a DSM-5, a DSM-5 word that has been thrown around the last 4 years. You can probably guess with number 45 is narcissist. Tell us what and because not everybody thinks we know what a narcissist is, and not everybody's a psychiatrist and everybody's a psychologist. Everybody knows and wants to diagnose people. Sir, please, for the record, what is a narcissist and how can they be treated?
Okay, so this it's a personality disorder, so that's what it is. So medication is, you can't say, oh yeah, give them medication unless they have other type of comorbid symptoms or not. So a narcissist is somebody that has a highly view of themselves. They don't care about anybody else but themselves. So the world is kind of centered around them. So that's where we get the narcissist. You can't tell, I mean, with most narcissists, you can't tell them they're wrong. They're not gonna believe you. They think you're the one that's wrong. So when we deal with narcissists, you got to be pretty much straightforward with them. And you got to also make sure you're confident in yourself when you deal with them. That's as me as a provider. And so, because like, here are the rules and letting know what's going on and how they affect others around them. So therapies could be probably one of the best ways to help a narcissist. Medication, like I said, would only be effective if we're treating other symptoms, if they have like ADHD, anxiety, or whatever disorder that may be grouped along with the personality disorder. So that's what it is. It's more personality disorder.
Thank you for that edification and clarification. Since it's been thrown around, I wanted to make sure we got you on here to tell us about that. We did have a question. How do you get help for someone who we know is experiencing depression? So back to depression. We want to know how we can get help for somebody close to us.
So the first thing, one of the things is, if you notice that you have a friend or family member or coworker, first check on them and see what's going on. Just say, it's tough to come up to somebody and say, hey, I think you might need help. So I want to give you kudos first in trying to initiate that, just saying, I've been noticing such and such, and I really care about you. I want to see you get better. Is there anything that's going on, how I can help you? And just listen and just let them to talk because I think that's one of the things is people just want to be heard.
That's it.
Even if somebody's struggling, they say, no, I don't want to talk about it. They really, some other times they do want to talk about it, because the moment they feel comfortable and open up, they'll start pouring what's going on. And when you hear that, you can encourage them and say, hey, I think that, because you have to make sure you know you don't have this, you're not a therapist, and they could vent to you, but they might need somebody that is trained in the science of providing these services. So make a recommendation, and even say, hey, I could help you. Maybe I could help you look for somebody, because I'll tell you this, a lot of times people who are depressed don't have the energy to even go on Google to
there you go,
search, because they don't have that motivation because of the depression, not because they're lazy. So I want to make that clear. They're not lazy. It's just the disorder there makes them have no motivation. They feel hopeless, low energy. So say, hey, let me look for it, and maybe what kind of provider do you want to see, or and they'll tell you, and then you look for it. You could go on Psychology Today, Google psychiatrist, therapist near me, and then from there you go and see if that would be a good match, if it's in their insurance or if they're out of network, whatever. But that, I think that's the one of the best things is to support them and help them, follow up with them and say, hey, I think if you could offer to help them search, I think that will be a big help.
And I think that's such a key point that you brought up, that because of their depression, they may not have the energy, the will, or the drive to be able to get help. So you really do have to be their personal assistant. And
Mhm.
most insurances do carry some type of behavioral health services. Most employers do provide that as well, most times free of charge. So you can definitely look out for those avenues as well. We have about 5 minutes, and I do want to ask a question that has been kind of asked throughout this series is, now that people are getting therapy, they're realizing that, hey, I experienced a lot of trauma in my life. And maybe that's the reason why I behave the way I behave, or I think the way that I think. How do you know when maybe I experienced a traumatic event in my past that's now showing up in my future, and because of that, I should get help?
Yeah, trauma is like, thank you for bringing that up. Trauma and stressors are very
Mhm.
big in people's life, because once a person experiences a trauma, like even years ago, it takes root. And once it takes root, it
Mm.
helps to grow. I look at like a tree, a tree, you see the finished product with the tree coming out, but when you look underneath, there's roots. And
Yes.
trauma is some roots in person. So if a person was physically, emotionally, sexually abused, whatever abuse or something they witnessed or domestic violence they witnessed, that's ingrained in them. And so that kind of now shapes the way they interact with others, their trust levels. And it could also, if untreated, it could also affect their, like they could have nightmares, flashbacks. They're always looking for threats. They're avoiding reminders of their past situations. They could have an irritable mood. And it also could be comorbid with anxiety, depression. So trauma's like, I'm glad I'm in this field, because as I've learned that despite whatever background somebody has, that if somebody's traumatic experiences, I learned not to judge them, but try to
Correct.
empathize and learn from what's going on and how we could serve them and point them in the right direction. So I'm glad you definitely brought that topic, because a lot of people are suffering silence and have traumas that they don't talk about. Either being a child, being verbally abused, bullying, that's huge.
Say
Like
that again now.
bullying.
Bullying.
Yeah.
Yes. Yes.
Oh my God. Like all the people that some people I've met that were bullied in the schoolyard, I mean, the school, it just it sticks with them when they come to work and whatnot, because they were victims of bullying. They were made to feel lower than themselves, and it just carries on. And so that is a traumatic experience for somebody, or even somebody being bullied at work as well. So like there's a lot of healing to go on about the traumas that people have experienced. Even this COVID-19 as pandemic has been a traumatic experience for some people as well, with loss of jobs, loss of family members, their health. So
Have mercy.
yeah.
Have mercy. Yes. And, and like you said, it can be enmeshed. Trauma can be enmeshed with so many other diagnoses, so that we know this is not a weekender thing. This is not, oh, I watched Iyanla fix my life and now everything is Gucci. This is, honestly, people need to see a professional, because as a commenter said, you have to strip back those layers to figure out what is the core, like you said, what is the root, and then start to heal those things. Those things obviously don't go away, but so that you won't be as triggered when, like you said, seeing certain things or being in certain environments don't take you back to that moment that you experienced that trauma. So we know that we need our mental health providers. So you, Dr. Olele, I just want to say thank you so much for being with us. I do want to give you the opportunity to, if there's anything we didn't cover that you want to cover with the people, this is your chance.
One thing I would just definitely say is check me on your loved ones and family members or friends. Somebody crosses your mind, give them a text or see how they're doing, because you don't know if that's God talking to you to talk this, reach out
Correct.
to them, but do that, because a lot of people are, one of the things I've noticed, a lot of people are struggling with loneliness. Either you're lonely because you're not with your family's in another country or another state. You feel lonely because you're not around people who are like the same intellectual, just like interest level, intellect, whatever, what you're experiencing your loneliness. There are people that just feel alone. And like, that's, the beauty of with the church, when the fellowshipping, so you don't feel alone. So that's why one of the things I'll say in regards to mental health, just check in on somebody and see how they're doing. That goes a long way.
It really does. It really does. And, you, husband of one, father of two, I'm a single lady. And so being in this pandemic, it really did get lonely. And I'm one of people, I don't know, I'm introvert and I'm extrovert. So I get power and strength from both, but it got a little tough, being by yourself, coming home to your TV, every day. And I can imagine how it was for people who worked from home and really did not see anybody. So, like we talked about earlier, God speaks to us in various ways, and he may tap on your shoulder and say, we need you to see a mental health provider. He may also tap on your shoulder and say, hey, check on that strong friend, because we all have, our weaknesses.
Yes.
Again, thank you so very much. Oh, somebody else had another question.
Sure.
What do you do for people who don't have insurance? Now, I know that many local health departments do have mental health services that are provided, but where else can they find help for mental health issues if they do not have insurance?
So one of the, every county or state is different. So I'm just going to be very generic with it.
Okay.
Finding your local Department of Health or Department of Mental Health, if they have a community board. And so a lot of times they're able to take people with insurance. But if you have more of a disposable income or more, you can also look, there's out of network providers as well that treat people that don't have insurance. So you could go out of network as well. So that's another possibility.
Correct. So there are things out there for everybody who is seeking for mental health treatment. Dr. Olele, we can find you on www.gpsmindset.org. And I know that you are now doing virtual appointments because of the pandemic. So people want to find you. I'm assuming that you are licensed in Virginia, Maryland, and DC.
Yes.
Perfect. So he can be reached that way. And again, GPS Mindset on Twitter, on Instagram, on TikTok, on Facebook, on YouTube. We can find you and your beautiful wife, who I got to watch many videos of and just fall in love with your love story all over again. So shout out to Dr. Chichi Olele. Thank you so much, Dr. Olele, for being with us, helping us to see that, yes, there are services that can be provided safely in terms of therapy, in terms of counseling. But at some point, some people do need medications, and it's okay to take medications, not just medications by mouth, but there are treatments, like you said, talk about nasal treatments, ECT that I got to see, and that was kind of eye-opening. But I remember there was the patient that I saw, he said he tried everything, that he was on and this was a elderly gentleman, yes, probably in his 60s or 70s, who said he tried everything, and it wasn't until he got the ECT, the electrophysiotherapy. No, say that again.
Electroconvulsive therapy. So
electroconvulsive therapy, yes. It is very interesting to see, yes. But he said it's the only thing that worked for him. So again, these are things that only a psychiatrist, a physician can order for you and treat you with. So again, we have the full spectrum of psychologists, psychiatrists, licensed clinical workers who are all here to help us be healthy, mind, body, and spirit. So thank you again, Dr. Olele. You have no idea. Our church has been so blessed, and whoever else watches this, we just want to say thank you. And again, it's Mental Health Awareness Month, so please, everybody, take care of your mental health. And again, thank you so much, Dr. Olele. We sincerely appreciate it.
Thank you. God bless everybody.
Same to you, sir. God bless to you and your family.
Thank you.
You're welcome.